Good morning everyone, hello and hi. So this is me Shubhasta Khan and today I will be teaching you about Down syndrome. So do you know what is Down syndrome? Okay, so Down syndrome is 21st chromosome ka trisomy. Trisomy means, as we know, in our body there is 23 pairs of chromosome. So what happens in the 21st pair, there is a trisomy. One extra chromosome is present and that is the Down syndrome. So who all are at risk of delivering a baby with a Down syndrome? Any mother whose age is more than 45 is at very risk of having a child with a Down syndrome. So how can we prevent this Down syndrome? So what we can do is during the antenatal period, there must be some regular checkup for a female, like quadruple test and like AFP protein test, chorionic villi sampling and all. So I think these tests are very necessary as the stress prevents to deliver a baby with such abnormality that the life of baby will be difficult, as well as there will be complication for the families as well. Okay. So, what are the symptoms a baby is presented when a baby is born with a Down syndrome? How we will find that this baby is suspicious of Down syndrome? Okay. So, with the explanation, I'll share you the videos of the Down syndrome baby just from my clinical. Like, I witnessed a baby in ICU and that small baby of 2 months was diagnosed with Down syndrome. So what all the features a baby with Down syndrome has? Down syndrome baby has like flat face. Okay, the face will be flat. The skull will be small. That is called brachiocephaly. This nose bridge, what we are seeing now, it will be depressed nose bridge. And there will be some folds called epicanthal fold. Like here there will be one extra membrane at the corner of the eye in the inner canthus, and we will see a pink color membrane that is called epicanthal fold. And what will be, as you know, suppose this is our eye and this is our ear. When we make a line from eye to ear, this line will cross 1/3 part of the ear and 2/3 part will be down. But what happens in a baby with Down syndrome, if you draw a line from the outer canthus to the ear, this line will come above the ear, and this is this is one of the symptoms of Down syndrome. Then there's something called mongoloid features. So what happens in mongoloid feature, as you've seen in Chinese? Okay, so what happened, this eyes is like this. So in a baby with a Down syndrome, you can see some mongoloid features like this. Okay, and some other features are like clinodactyly. Clinodactyly means the fingers will be like this, bones will be disrupted. That is called clinodactyly. Okay. Now there's something called sandal gap. I will be sharing in the video as well of what is sandal gap and with clinical presentation. In the legs, there's a toe, and between toe and the finger, beside the toe, there will be a gap. There will be a large gap that is known as sandal gap. So these all are some features that a baby presented with a Down syndrome can have. And other than that, the baby will have heart anomalies, congenital heart anomalies, and most particularly if you talk about it, is like atrial septal defects or ventricular septal defects can be seen in the babies with Down syndrome, as well as GI abnormalities. A baby can have duodenal atresia, and it is a very important feature. Like if a baby is suspected with Down syndrome, please do check his thyroid, and he will be presenting with hyper. This baby has a flat face appearance. The nose is depressed, as you can see in this video. The ears are low as compared to the normal baby, and if you come to the extremities, we will have some other findings like sandal gap. So this is the sandal gap. There's a difference. There's a space between the thumb and this finger. So it is not normal in other babies. So this is called sandal gap. And when you come to see the creases, semen crease, a single crease may be present or may not be present. For this baby, semen crease is not present. Then as you can see the rise of a chest wall, the baby is with atonicity as well as atrial septal defect. As you can see, the head is small and it is a brachiocephaly. So the mouth is very wide open. So these baby had many features of Down syndrome, and he is diagnosed with a Down syndrome. And if you can see the eyes, the appearance, and it is very difficult for this baby to survive and to have extra life.